And will our lovely assistants please reveal the cause? Possible culprit? Low testosterone.
Low testosterone.
We've been hearing more and more about low testosterone. I think it was sort of under the covers for a long time there, but now you're hearing about it more and more, and it can affect both men and women. That's an important point. Now, with men, on average, some say that after the age of 30, you're losing about 1% of your testosterone every year. That means by age 70, you might be 50% or more down from optimal levels. Well, what does that mean? Gradual decline in testosterone is normal. However, there are other possible causes of low testosterone, certain medications. If you've ever taken performance-enhancing drugs, there's a problem. I'm going to explain why. When you're taking steroids, which is essentially what we call exogenous testosterone, you're taking testosterone, it basically tells your testicles
to turn off.
Yeah, you don't need to make testosterone. I got plenty of it here in the pill. So they shut down and they shrink. That's why you don't want to take performance-enhancing drugs. Enough said, right?
Yeah.
I mean, seriously.
In a nutshell.
You think you're taking it to boost performance, but in the end, it causes fatigue. It's no good.
Right,
No
because
bueno.
your baseline testosterone can, in many cases, be lowered.
This is becoming more and more recognized. I've had several friends just, be either fatigued or just didn't feel right. One of them actually thought he was having heart problems, and it all turned out to be low testosterone.
And when women go through menopause, not only do they lose estrogen and progesterone, but also their testosterone goes down, and sometimes this can be a cause for low libido. So we'll also give women sometimes some testosterone to increase that libido and energy as well.
And two other things that are so very common in our society right now also lower testosterone, and I think we're all going to recognize these when I say them. Stress and obesity. We have an epidemic, I think, of stress and obesity. One begets the other, and then that could beget lower testosterone. You have less energy, you're more stressed, you don't want to work out. So that's why low testosterone needs to be fixed. But another thing I'm seeing maybe too commonly, especially out here in Los Angeles, you're seeing more and more guys with normal testosterone levels being convinced to take medical testosterone so they can, look big in the gym. I'm seeing a lot of it. So you got to discuss it with your doctor.
I get accused of that a lot. People oftentimes, I just want to clear it up. I've never taken testosterone.
Poor Jim.
Because of how small your testicles are?
Nice one.
He grows a pretty good beard, though.
There you go.
Well, we received an email on this topic from Brad in Rockland, Maine, who writes, "Hi, doctors. I was wondering if there are any physical signs that I can look for on my body that would indicate low testosterone." Well, Dr. O is going to show you one of the physical signs you can look for in just a minute. But let's hear, first of all, what urologist Dr. Jennifer Berman had to say.
Testosterone is considered a sex steroid, and it is a hormone that is really important in terms of fertility in men, but also important for energy, memory, mood, lean muscle mass versus fat mass. The three main symptoms men experience as a result of low testosterone levels are loss of libido, erectile dysfunction, as well as fatigue. Men with low testosterone levels can also experience depression, disruption of their sleep, weight gain around the central area. Andropause is basically time when testosterone levels decline. So men in their late 40s, early 50s may start to experience symptoms of low testosterone levels. If you feel like you're maybe experiencing low testosterone levels, it's important that you speak to your healthcare provider and also do everything that you can to eat healthy, exercise, and minimize your stress.